We're going to get to it. We are here to talk about what the private sector can contribute to helping make America and the world a healthier place. No small task. I think we're all used to talking about how the profit motive may be contributing to making us perhaps less healthy and driving healthcare costs up. I know as a journalist, I tend to write about that quite a bit. But there are also a lot of CEOs and boards and executives who see better health as better business, and I am pleased to have some of them here with us today. So we are going to proceed like this. I will briefly introduce the panel in alphabetical order. They are all way more accomplished than I have time to tell you about, and you can read more about them in your books and on the website. Then each panelist will give a short, very short, I have made them promise, introductory statement about what it is they do. Then the panel and I will have a discussion for a few minutes, and then I will throw it open to you, the audience. And we must end on time because I have another panel right after this one, all the way at the other end of campus. So with that, we will get started. Our first panelist, all the way over there, is Dr. Troy Brennan. He's Executive Vice President and Chief Medical Officer at CVS Caremark Corporation. Before joining CVS, he was Medical Director at Aetna, and before that, President and CEO of Brigham and Women's Physicians Organization. Many of you probably know him, as I do, from his voluminous writings as a professor at both Harvard Medical School and School of Public Health. Casey Sheahan, who's here on my direct right, is a senior advisor at Backbone Media and former president and CEO of Patagonia. Before that, he held executive positions at outdoor company Kelty, as well as Merrell Footwear and Nike. He and his wife, Tara, who's also here in Aspen for the festival, are co-founders of the Conscious Global Leadership Institute, which he's going to tell you a little bit about. Finally, in the middle, Derek Yach is Executive Director of the Vitality Institute. He's been Senior Vice President of Global Health at PepsiCo, Head of Global Health at the Rockefeller Foundation, Professor of Global Health at Yale, and Executive Director of Non-Communicable Diseases and Mental Health at the World Health Organization, which we will also talk about. So a very august panel indeed. And Dr. Brennan, will you start us off?
Well, I oversee most of the healthcare stuff at CVS Caremark, and CVS Caremark is about half of a retail pharmacy chain. We have about 7,800 stores now across the United States, and then other half is pharmacy benefit management. Caremark is our pharmacy benefit management company. We have about 80 million people who we provide pharmacy benefit management services for, and we're extending further into healthcare. The most prominent extension is our retail clinic, which we call Minute Clinic. We've got about 900 of those, and we'll have about 2,000 within about 3 years. So that's where I work, and that's what I do.
I work for a company based out of South Africa called Discovery Holdings that many years ago came up with the notion that if you put prevention and health promotion at the core of life, health, and other insurance products, it'd be good for business and good for the members. They'd live longer, they'd pay their premiums longer, they'd lower healthcare costs. And so the structure was built upon behavioral economists showing that incentives really do make a difference, and that as people engaged more, their status went up, and they shared in the benefits of improving health by paying less premiums and getting rewards. Part of our work here really focuses on trying to strengthen the evidence base to ensure that what we use really works. The second aspect relates to trying to say there's actually a whole health economy growing here outside of the healthcare industry that is focused more on prevention. And we want to galvanize those forces starting in the US and outline a number of ways we're doing it through a commission whose report we released just last week.
Well, I'm tremendously honored to be here. Casey Sheahan. I retired from Patagonia in February, and I have been trying to fade into obscurity, but so far it's not working out for me so well. I'm really interested in the nature of organizations, and I think it relates to this topic today pretty well. Done a lot of research and internal reflection around businesses that are kind of driven by ambitious energy, frictional energy, versus those that have a higher purpose, that employees show up and have real reason and meaning for why they're performing their jobs or why they're doing things outside of their jobs every day. And another initiative that was important that I think is going to be part of what I will be doing and continuing on is this nature I call extreme transparency, which is not only looking at the health and welfare of your employees, but looking at your supply chain. And I don't mean by that just looking at the finished goods factories where there's a lot of auditors and people there, watching over the working conditions and the living conditions of the employee base, but also looking deeper down into the supply chain, to the mills, to the fields, to the farm workers, the oil field workers, et cetera, all the people who are connected in this web of life that results in product that companies like Patagonia sell. So those are important areas for me. And then as it relates to health and wellness, my wife and I are the co-founders of the Conscious Global Leadership Institute, and a lot of work we have done is bringing mindfulness and meditation into the workplace. Because at the end of the day, if we can prevent a lot of these problems by addressing the 3 forms of suffering that most humans have on a daily basis, which is physical, existential, and emotional being the most important one of those 3, I think we go a long ways towards making a happier workplace and happier vendor base and happier customers. So I have a lot to say about that, about stopping problems and preventing problems before they show up in some of the places where some of you might work, whether it's in the healthcare field or in hospitals.
So I think when we talk about the private sector and we talk about a healthier America, healthier world, we're really talking about 2 different things. One of them is about companies that actually are doing things to improve health, CVS, and companies that are doing things for their own workers. So I think I want to start at a very basic level, which is, let's talk about what wellness actually is. So I think, Derek, you want to try take a stab at that?
Well, I think wellness has become a term that's been severely abused over the last few years. So I'm one of the folk who believe we should scrap using it, because it now includes everything from mud therapy, foot reflexology, all which are very nice and may very well be useful to some people, to very hardcore programs that save lives, reduce mortality and morbidity, whether it's on the mental health side, tobacco cessation, and improving medication adherence. I prefer to use the term health promotion and prevention, which I understand what it means. And certainly within the workplace, we have seen that the term wellness has then been applied to a very wide range of activities, some of which obviously don't work to have any impact. There isn't much evidence on mud therapy lowering hypertension rates, for example, alongside those which are truly good. The companies that use the most effective interventions, whether it's J&J or Alcon or those who win Cooper Awards, show not only that they'll end up having better improvements in health, but it benefits the long-term bottom line of the companies as well. And a lot of it is driven in the start by the points you're making, clear leadership from the top. The CEO and the credo in J&J actually make a difference to the quality of evidence they use in the workplace. So in summary, I would say, I would hope we move away from the word wellness, that we actually look at what could truly work in the workplace, which is some traditional effective health promotion and prevention programs.
And Troy, would you talk a little bit about CVS and your decision to stop selling tobacco and how that sort of feeds into how companies are thinking about changing their where they're going in terms of serving this niche?
Well, yeah, I'd be a bit, potentially more crass than Derek in talking about, the wellness programs have traditionally been sort of try to get people to lose weight, try to get them to quit smoking, follow numbers with regard to sort of 3 relatively prevalent diseases, diabetes, hypertension, hyperlipidemia. Combine that now with biometrics, encouraging exercise, which falls into the sort of weight loss thing, and reduction of stress. And that reduction of stress is going off in the direction of things like meditation and the like. So clearly smoking is central to that. I don't think we'd have any disagreement about the morbidity and mortality associated with that. And so getting cigarettes out of the pharmacy is sort of a first step in trying to establish the pharmacies as a place where you do health care rather than, sort of a convenience store with a pharmacy in the back. For us, it's had an effect that's, well beyond kind of, I think, what we anticipated when we did it, both with regard to the overall reputation of the organization, but especially with regard to the way in which the people who work there sort of see the place. So it's brought a certain sense of pride and fulfillment and purpose, I think, in ways that are going to improve us as a company and improve our bottom line and return to shareholders in ways that we really didn't anticipate.
Where do you all see sort of the dividing line between government's role in promoting health promotion, however you want to call wellness, and the private sector? I know one of the issues for the private sector is that if employers are investing in healthier workforces. One thing we know about today's workforce is that it's much more transient than it used to be. So there you have employers investing in the health of a workforce that's going to go off to work for somebody else in 2 years.
Well, I don't see why the private sector wouldn't be totally invested in having a productive workforce, which to me means a happy workforce, happy customer base, and again to what we were talking about before, that really starts with the leaders themselves having a practice of some sort of mindfulness or awareness. And there's a lot of evidence. I was telling you about the Conscious Global Leadership Institute and local Aspen Brain Forum working with Dr. Deepak Chopra and Rudy Tanzig, who's the PhD scholar at Harvard in genetics and aging. And there's a lot of information coming out and research that a short practice of meditation every day actually increases the length of the telomeres or telomeres, however you pronounce them, but they're the nucleotides at the end of the chromosomes, which actually elongate your life. They reduce inflammation. They can cut back on the amount of heart disease you might have. And it's possible that through your own self-directed biological transformation that you can increase the length of your life and pass that along to your offspring. So this is very important work, I feel, that's at the front end of those times when you have to go to the facilities that these guys, are so comfortable with and get an EKG or get a high blood pressure test or something like that, which is after the fact showing that things are really going wrong in your life. So we're trying to get ahead of that and find ways to help people deal with their day-to-day suffering and come into a time of living observation of that suffering and get some more relaxation and calm that then helps their chromosomes and on and on and on.
I think if you ask the question of how important is the role of government in health, it's obviously fundamental. It can either do it really badly wrong, or it can actually lever a lot of the private sector initiatives more fully and find the optimal partnership between the two. So some examples. The most powerful intervention for tobacco control remains taxes. There are parts of the country where the tax levels are appallingly low. It's not surprising that those are the states with the highest smoking rates. It doesn't matter how much we do in the private sector side. In the face of having prices so low, you will continue to have huge incentives for people to smoke. In the food area, we've seen that government can send a signal about how to align better the interests of addressing obesity and overeating with the way it provides subsidies through the agricultural system. Currently, there's very poor alignment between what the US Department of Agriculture do and what DHHS is trying to do in ensuring that healthy foods are more affordable and that healthy foods are the easier ones to access. Once government starts speaking out about and talking more visibly about the value of healthy diets and what they are, the kind of thing Michelle Obama is doing, I think it spearheads a range of private sector initiatives, many of which we've started seeing growing, whether it's Birdseye then feeling that their vegetable marketing has a chance of taking off because people now understand that consumer demand is being stimulated and increased. Similarly, lowering salt in products, which is something many food companies are trying to do, is actually enhanced when government talks more forcibly about why that's important, that it will lower blood pressure, and blood pressure issues remain one of the major causes of death in this country. But getting that balance right is important because there's a great fear always of excess paternalism on the one hand, driving issues, and excess libertarianism, leaving it entirely to the market and individuals on the other. What we're now seeing is the marriage of the two through behavioral economics, which some people call libertarian paternalism. Cass Sunstein and others sitting in the regulatory office are saying this movement to nudge us, to make the healthy choice the easy choice, is the fundamental role of government working with the private sector. And that is a blend of both. Don't constrain choice, but make the choices that are are going to have long-term health benefits, the easy ones, like taking the tobacco out of the stores, immediately changes the choice architecture for people walking into a pharmacy.
You've actually anticipated my next question, which is some of the biggest pushback that we've seen about the Affordable Care Act has come from, what people call the nanny state parts of it. Even things like, calorie labeling. It's not taking anything away, but even just having the calories, up there for people to see. So if people are reacting to the nanny state coming from the government, how much more will they react if it's coming from their employers? And that's some of the pushback to some of these, these wellness programs. I mean, how and where's the line between having employers encourage and then having employers offer things that people might want, like gym memberships and a place to meditate and things that are obviously going to be enticing to people who are already of that mindset, and then pushing people who, as you say, may need more of a push in terms of being at risk for things. And I think that's where sort of the tension is, particularly in the employer community, isn't it?
I want to pick up on what on Derek's example about tobacco. Really, the public health success story, wellness story of the past the 20th century in the United States was reducing rates of use of tobacco. And it was effectuated primarily, as you said, by taxes, and then by basically sort of making it more and more difficult for people to feel like it's a normal thing to smoke. So don't let the smoking occur in restaurants, public places, and the like. I think that though the government's gone about as far as it can, and we go out and sort of talk to people in the government, and they've really feel like, you know, they can't, those places that have high taxes can't raise the taxes higher as those places that have low taxes aren't going to raise them. So really it's a place where industry can begin to sort of fill in. And at least from our perception on this, go back to this sort of tobacco and pharmacies issue, you know, people smoking, it's a very dynamic occupation. You know, you're never sure, or at least half of them aren't sure when they're going to quit smoking, but they think they're going to quit smoking, and a lot of their purchases are sort of spur of the moment. So if you begin to sort of decrease the number of places where they're exposed to tobacco, you'll be able to sort of lower rates still further. That's probably going to require activity, voluntary activity by corporations. But I think it's the kind of thing today that more and more companies are going to sort of feel like it's attractive. I think that the entire country sort of feels the weight of the obesity epidemic. And with put on top of that an aging population, we're beginning to know that we have to do something about taking better care of ourselves. And so companies that do those sorts of things and make those kinds of steps, I think consumers are attracted to that, and that's the business interest.
I think every step forward in public health, which we now assume is kind of obvious, whether it's seatbelts or smoke-free public places, always starts with enormous resistance from some industry sector, always. And the arguments usually used are about government paternalism and nanny state and so on. But the proof is that as people start seeing results, and results in terms of better life, longer life expectancy, understanding the value of it, public support grows. If you look at the long course of time, we've seen that this has been the case. If you think back to the era of when there was no occupational health and safety at work, industry complained when they had to stop this machinery which got people to lose their fingers and their toes in machinery. We no longer say this is the paternalistic state putting protective gear in place. When we had asbestos in the workplace, the environmental movement got up and started bringing in asbestos controls because otherwise you'd have lung cancer, mesothelioma. At the start, it was seen as paternalistic. Now it's seen as obvious and protective. And I think that occupational health and safety notion now is having to be applied in the more complex areas of behaviors related to what people, whether they smoke or eat and drink and move. But in time, if we get it right, I think we'll have the same positive impact and the same positive public support.
Well, I think too that even with public sector and private sector support of these programs, whether health, wellness, you know, better eating, drinking better water, exercising, even mindfulness and meditation, that the human population will start to live better, feel better, and look better. And it's almost like, you know, vaingloriously that the looking better part of it is probably what's going to get most people down the path of health and fitness.
Hey, whatever works.
Right? Whatever works. And if someone says to you, gosh, what did you do? You look so relaxed and calm, and your face, your complexion. I've been meditating a lot and eating good food and drinking good water. I think that's going to be more effective than any regulations we can impose.
Can I just give you one example of, while I agree with you, I still think the government role here is important. We have a Mental Health Parity Act in this country, in name, not in practice. We rarely see senior politicians talk about the value of meditation or mindfulness, or talk about the issues of dementia or depression or schizophrenia. The moment they start doing that, we see a destigmatization of this issue. And then the private sector is able to actually explore the implementation of mindfulness and a range of other programs. Just look what's happening in the UK, where Prime Minister Cameron chaired a major national debate on dementia. This is the Prime Minister talking about dementia. It brought in CEOs who've experienced dementia in their family and in their lives. The impact of that, I can bet you, over the next few years is going to profoundly change the opportunities for the entire area of mental health, which remains severely neglected.
So I preface this question as somebody who couldn't even get the printer to work earlier, but the new iPhone ad, I don't know how many of you have seen it, is I think 30 or 45 seconds of all of the fitness apps that you can get on the iPhone, and I'm just wondering, and you know, the last one was about taking pictures, so I think this sort of says something. Is technology possibly going to bail us out of this?
I personally think technology can help, but it's almost rearview mirror thinking when you're wearing smart clothing and bands and you can look at your iPhone and get all your data out there. That's great, but you know, the destiny you're creating around your ultimate, you know, fitness and you know, reduction of suffering is a process that began many, many years ago. So it's almost like, well, you're seeing it now, and that's great. Time to go to the hospital, time to go get an EKG, that's a little late. So maybe there are other predictors that can be used through smartphone applications that will be useful many years before these actual problems show up. So I'll be curious to see.
These are all the fitness apps.
I'm saying the fitness apps, to me, these are indicators of emotional trauma that you're seeing. You know, high blood pressure, elevated heart rates, all these things, stress reactions, you know, heated body temperature. These are all the kind of things they're going to be able to measure.
I think that, and all of those are being measured on these personalized devices. One of the things you may want to look at, we worked with the Institute of the Futures to look at what is coming in the next 10, 12 years in terms of these kind of technologies. Why is it that Samsung and Microsoft and General Electric and Apple are fast becoming bigger investors in health than the pharmaceutical companies? What does that mean? Is that good? Is that bad? I happen to believe that it's good, because they focused on the prevention side. For the first time, we've got a serious counterweight to the pure treatment and care side. And what are these devices going to do? For some, we are just at the starting point of having these personalized devices help us with all of these issues. Understand the role of emotion in our diets. Understand the importance of depression when we're about to take a cigarette. Understand the importance of lighting and how it's affecting our sleep. These movements are unstoppable and moving very fast. And there, interestingly, the role of the government is becoming very complex because it's not sure how to regulate these things, how to ensure that they don't cut off the innovation that could have huge preventive capabilities. From my point, and for the theme of this session, what I find exciting is the fact that we've got new voices coming to the world of health and starting to create what I said is a new economy of health that isn't just driven by pharma, medical devices, and hospitals, who we all desperately need when we get sick, but are driven by IT and software companies, small entrepreneurial startup companies that many of you would have heard of, coming out of Palo Alto, and a wide range of others, all doing one thing, trying to find a business model that works for them, that simultaneously promotes prevention. And so I think that the role of technology is going to be decisive, with two big caveats that we have to watch out for. One is that we know that technology, without addressing the behavioral aspects, can lead you down the wrong path. So when the behavioral economists work with the technology developers, we'll end up having high usage and continued usage. And the second aspect is that there are ethical, legal, and social issues very much tied up with personalized devices, the data flows, the privacy concerns that we need to get ahead of. And the Institute of Medicine has recently announced that it's going to bring together people to think about how we can address this in much the same way as 2 decades ago we had to address the ethical, legal, and social issues related to the Human Genome Project.
They pay me out to be an internist, and so I have to sort of look at the data, and there's no data on it yet. I think it's promising, but there's a tremendous what we would call susceptibility bias associated with it, because a lot of the people who are sort of out exercising, the people who are sort of using the devices anyway. I hope it does, and I agree with Derek that these are things that can sort of take notions of sort of staying in shape and make them ubiquitous. But on the other hand, it takes a lot of hard work. And when we look at these things, what I worry about is they look easy. You look at the number of randomized controlled trials that have actually shown weight loss, through a program. There's only a couple, and there's literally thousands of them out there. So these things are hard, and I'm not quite certain that sort of counting your steps in a fancy way is going to do it. But I hope so.
It's early.
It is early, and there are studies ongoing. So I think we'll find out.
All right, I'm going to throw it open to the audience now. I think there are microphones. There's one. Who's got a question? up here. And I'd love it if you could introduce yourself so the panel knows who you are.
Hi, I'm Lauren Silverman. I'm a reporter for NPR member station KERA in Dallas. And I have a question really for Mr. Brennan about the CVS decision to change what it was doing with cigarettes in the store, and what kind of reaction you received from customers in terms of, was there any disappointment? And also what kind of financial argument you had to make to convince shareholders that this was a good idea.
Well, they're not out of the stores yet. So we promised to get them out of the stores by the fall. And there's a variety of sort of business reasons associated with that. But I can tell you that, for instance, one of our supervisors was in a store, and there was a person who was buying cigarettes there, and he was berating the person who worked behind the register about the fact we were taking the cigarettes out of the stores. The person who was working behind the register said, I think that this is the best thing we've ever done. It makes me so proud to work here. And I think it underlines the point I made earlier that, you know, some of these things are just good for the overall sort of vitality of the organization. With regard to the business decision, I mean, we told our investors that you know, we wouldn't have any hiccup with regard to the finances that we had promised, and we think we can handle it. It's about, as we've said, it's over $2 billion in total sales that'll go out the door. These cigarettes are, in most pharmacies, the sort of #1 item in the front store. So, but we feel like there's a lot of other things we're going to be doing in healthcare. And in order to sort of say we're a healthcare company with a straight face, we had to do this. And I think what I'm seeing is it's going to sort of reverberate in terms of the other kinds of products that we offer in the store. And, you know, a sort of hard turn towards what might be considered wellness. But I think that we believe, and we believe that our investors believe, and we believe that our customers believe that, you know, this is a place where we should be headed. So I think we're pretty confident about it, and certainly we're all very gratified by the decision. There were a lot of people who were holding their breath that the stock didn't go in half, and instead the stock went up.
Yeah. Just maybe to say, I was at PepsiCo for many years, and I think the brave efforts by Indra Nooyi to try and transform the portfolio didn't get the same speedy, positive response. That doesn't mean that they're going to backtrack. It just means that it's going to take a lot longer. And I think that we're all thrilled, and we take heart by both the way the share market responded, as well as consumers are commenting. I was telling Troy earlier that the reverberations are just starting. So in the UK, the second largest retailer in the world, Tesco, was very interested in this and thought, well, you know, what's their equivalent? They haven't done tobacco yet. And you may have seen less than a month ago, they announced they'll take sweets and candies out of the checkout counter for almost the same ideas. It doesn't mean they're going to take them out of the store, but the symbolic value of actually sending a signal about what is desirable for kids and young families and others to see when they're in a checkout counter has enormous implications, and starts saying, if we're really committed to the long-term health and welfare of our consumer base, we need to make these changes. And probably for the short term, there may very well be an economic hit, but over the long term, they're betting that you're going to get a flow of new customers coming in who are going to be going there because they know the values of the company and the products are better aligned.
In the back, all the way.
I'm Kurt Malkoff. I'm a PhD clinical psychologist who owns an employee assistance program that provides mental health services to large corporations all over the country. I've been sold on the fact that the psychology thing is pretty important. One of my concerns in listening not to this panel, which I found very interesting, but through the whole week, is that we're approaching this as one size fits all. The United States has 313 million people, so to compare us to Japan or England that has a third of the size is somewhat insignificant. Can you gentlemen speak to the issue of how we can send the same message but package it differently to the Aspenites who by 9 o'clock have run 5 miles and read 3 newspapers versus somebody in, you know, an impoverished area in Mississippi or whatever that, you know, it just doesn't, the same message doesn't resonate even though we're trying to hit the same metrics.
I don't want to jump into it, but I think you heard Lavisa More yesterday from Robert Wood Johnson Foundation. And they've been spearheading the use of county health rankings, which makes exactly your point, that the US is not homogenous in terms of its underlying risks, nor the underlying life expectancy. If you took the best counties in the country, they exceed the best of any country in the world. If you take the worst, they're down at the level of Bangladesh. And some examples, you have twice the premature mortality in the worst counties than you do in the best. Twice the mortality, premature mortality. 4 times variation in smoking rates between the best and the worst. So if you don't tailor your interventions and your programs, whether you're in a corporation or whether you are the local government, you're simply not going to have the desired impact. The problem is that underlying a lot of the worst health statistics in many parts of the country is obviously the concurrence of poor health risks and poor health outcomes and poverty more broadly. And that speaks to the need that you're not going to have long-term benefits only coming through health sector interventions, but you have to tackle housing and education and many of the core determinants of health as well.
Right here.
I'm David Sklar from Academic Medicine, and my question is for Dr. Brennan. As I hear you talk about your acceleration into the healthcare delivery market in your pharmacies, how are you thinking about the potential conflict of interest of providers there who are in a pharmacy and the at least subtle or maybe not so subtle pressures for them to write prescriptions, which then the pharmacy will be providing at a profit for the pharmacy. Any thoughts on how you're going to handle that?
Yeah, I mean, as a public health person who was involved in healthcare delivery for a long time, I think one of the big problems in the United States healthcare system is provider-induced demand. So we're trying to stay out of anything that has to do with provider-induced demand. But there are some places, like you suggest, where we have nurse practitioners, and most of the people in our minute clinics are nurse practitioners as the providers, where they're going to write scripts for common ailments that people are coming in for. So we have to study it. And really the 2 critical things that we looked at, we've published papers in 2009, have another one coming out in about 2 weeks, is the overall quality of care that we're providing. And we do this in the peer-reviewed literature so that we can make sure that it's not just deckware that we're talking about, but rather something that other experts have looked at and say, this looks like good statistics. And the critical thing there is, sort of how much antibiotics and other medications are we prescribing compared to primary care providers, urgent care, and emergency departments. And in both the papers we've published, we show that we're slightly less, in fact, a good deal less. If you go to Minnesota, go on their public website with regard to ambulatory care measures, one of the key ones is whether or not patients with respiratory ailments are being treated with antibiotics. It should be low. We overprescribe. And I have to say, Minute Clinic's at the very top of that list. We outperform the Mayo Clinic, all the major integrated systems in Minnesota, because the nurses are following practice guidelines. The other thing I think you have to ask is, sort of what percentage of our scripts are being filled at CVS? It's obvious that you're in a pharmacy, you got your care, seems like most of the scripts are going to go, but we explicitly tell people this script can be filled anywhere. It's about 82% of the scripts are filled in our own pharmacy. So these are the kinds of things that we try to keep an eye on. But I think the most important thing is, are we following practice guidelines, and are we providing evidence to our customers and to people like you who might be interested in scientific publications that that is indeed what's happening?
Isn't this one of the places though where what you need to do medically and what's for the convenience of the customers can kind of run at odds, because obviously the customer wants the one-stop shopping. So you have to make sure that you're doing it right. On the other hand, the problem with the physician-induced demand is that one of the frustrations of patients, and one of the things that makes them want to go to Minute Clinics is they don't want to go to the doctor and then have to go to the pharmacy to get the script filled.
Right. Well, obviously, yes. So what we can do is tell them this can be filled anywhere, and it's good from my point of view to have evidence that some people are actually going and filling them somewhere else, so that when questions like this come up, that's the answer that we have. But clearly, convenience is important, and it goes back to our discussions about what might be considered health promotion or prevention and wellness. Convenience is a critical issue. Convenient access to tobacco makes it that people smoke. That's why the tobacco companies pay us for that specific place in our store, right where you're standing to check out in order to get the cigarette products. But it's also important with regard to healthcare. If you could go and get your blood pressure checked and have your statin levels taken, analyzed, have that sent electronically to your physician, and you could do it at our places, which are designed to be convenient. That's what we, Rite Aid, Walgreens all do. We set these stores up to be convenient. It's going to promote health simply because convenience is a critical issue. The behavioral economists would tell us nothing else but that, really.
A lot over here. Right here.
Hi, my name is Lynn Voss, and I work in healthcare advertising, so I've got a lot of pharma clients. So I want to ask the question slightly differently about CVS. We know that non-compliance is a huge problem with pharma. About 45% of people don't ever fill their prescription at all. So I'm wondering how what does your data look like? Are we getting a higher level of filling if they actually come to the MediClinics versus outside in the general community?
Well, I think it goes to the core of the question here about sort of for-profit business. The big problem with medications is that people don't take them. For maintenance medications, at 6 months, about 50% of the people are taking them. And about 50% of the time, the doctors are prescribing all the medications that they could prescribe. So from our point of view, a company that makes all of our profit on medications, and by and large, inexpensive generic medications, if we can solve these problems, we can increase our revenue and hence our profit dramatically. So it's in our interest as a corporation to be pursuing what is essentially a public health task, that is to get people to take their medication. So it's more than just MinuteClinic. Throughout the pharmacy, we have a variety of new interventions that we're putting into place, and we're constantly out listening to these entrepreneurs, people who are making devices in the home to tell us when people aren't taking the medication and the like, in order to find things that we think will help promote people taking their medication. And again, behavioral economics comes into play, because not taking your medications after you've had a serious ailment of some sort, for instance, you come out of the hospital after having a heart attack, if you take the medications, the 4 medications that you're supposed to take, you'll decrease your chances of having a second heart attack by 70%. Not taking those medications is irrational. So what we're trying to do is, how do you address this irrational behavior? And that's what behavioral economics is about.
I think it's a really critical question, and people often don't put the issue of poor medication adherence high enough on the agenda of quick wins for individuals as well as for the private sector. And I don't think this is a conflict. This is a true confluence of interest. If pharmacies sell more stuff and make more money and people take them more, we're going to see the gap between the non-adherent and the adherent shrink. So just to give you a sense of what we're talking about in terms of lives, people are often unaware that if you look at people on just blood pressure treatment, those who adhere to their blood pressure treatment and those who don't, the impact is 4 to 5-fold in terms of deaths from stroke and from non-fatal strokes as well. Well, what interventions do we have that can close that gap, as well as having people who've already been given a prescription, already had a diagnosis, and merely need to be nudged, supported, and engaged to actually take their medications? One of the problems, and of course I'm thrilled to hear Troy say we're going to encourage some of these devices and behavioral economic measures. I think that is going to be the key, including SMSs. There's a whole range of things we can do. But what is hampering us are the points that you raised. People also are unaware that depression is a major risk factor for non-adherence. And many other mental health conditions impede people. So if you're not going to take a holistic view of the patient's needs, it doesn't matter what devices and what support you give them. If you haven't addressed the depression or some other aspects of mental health, you're not going to get the gains that you could have in improved adherence.
Over way in the back.
My name's Jewel Mullen. I appreciate your comments, and I appreciate what you all do. In my role as a state public health commissioner, I get to hear the concerns of primary care physicians who now feel they are in competition with CVS, for example, at the same time that I hear the concerns of local public health directors who feel that they are being edged out of the immunization market. And it's really sad to me to consider that with the undervaluing of prevention, prevention is becoming like another competitive marketplace. So I'm wondering what you're doing at the state or local level to actually create a future partnership with both public health and primary care to get all the impacts that you want to achieve?
Well, I would say about ours, we don't intend to be we're not primary care providers. We feel like we can help complement primary care, but all of the information that we have goes back to the patient's doctor. Now, only 50% of the people who we see in our clinics, and we're seeing over 2 million a year now, have a primary care doctor who we can send anything back to. So we have relationships now with about 40 integrated delivery systems, some of whom have been talking up here over the course of the last few days, where we work very closely with them and we refer patients into them. The integration with them is aimed at getting integration between the electronic medical records so that they have complete access to everything that we're doing. We don't do chronic disease. We will do chronic disease as we develop these relationships. So we're working directly with physicians, family practitioners, pediatricians, and internists. So we see ourselves as not the medical home, but helping the medical home. And with regard to the public health authorities, by and large, most states have been very pleased with the fact that we and Walgreens and Rite Aid and other retail outlets are now promoting vaccines. There's an unwritten paper about the fact that vaccination has become more widespread over the course of the last 4 years. And probably most of that is occurring in retail settings, at least 15 million vaccinations for flu, for example. And we're also, because we're a big corporation, we're not afraid of providing vaccinations that are relatively expensive and many docs don't want to buy and then have in the office. So I think there are overall very good stories there, and as we educate people, they understand it. Having said that, there are still going to be some group of providers who are always going to fear competition, and I understand that. I was on that side for 20 years.
Anybody want to add anything? Over here?
The healthiest thing I ever did in business was fire myself for working too many hours. And there's a new concept that I'm aware of. I have a lot of younger friends in Ann Arbor. And it's unlimited paid vacation and an open bar in the workplace. I mean, they're all, of course, in the technology industry. And they say it's becoming quite prevalent. This doesn't make sense to me. I'm Protestant work ethic, but are you seeing this? Is this actually increasing productivity?
Well, I can speak. I worked for a company like that for 9 years, and it was all about enjoying life, getting out in the outdoors, doing things like that. I mean, really, there's maybe 4.5 hours of productivity in any given workday. So what are you going to do with the rest of your time? Stare at the computer screen, or walk around the office and eat the chocolate chip cookies that somebody brought? I think it's really important to have a really focused work life and get the job done, get it behind you, but also plan your day, create your vision for what you're going to do with your company in the coming days, months, and years, and then go for that. And I really believe that sabbaticals are incredibly important. I think that paid internships that are connected to the mission of your company are really important. Having your children there on site with you. Patagonia famously had a very good child care facility. I mean, the importance of having family around you is unbelievable what that can do in terms of unlocking creativity, creating more passion and connection to what the company's about, and just creating a healthier employee. So this all works together, what you're talking about. It is incredibly valuable, and more businesses, I think, mostly in the tech sector, they seem to be moving towards this right now with ministers of spiritual ministers at Google and meditation rooms and places to do yoga. It's moving beyond just the big gym with the track and the weight machines and the swimming pool to something that's a little more dimensional than that. So that is the future of modern business, and I think it'll look even more dimensionalized as we look forward into the future in the next 20 years.
Is there a business, I realize some of the big tech companies are doing it. Is there sort of a way to capture this for more businesses? Or do you think it's just going to be sort of as businesses that can afford to do it, or is this a generational thing that's going to be demanded?
Well, I think we're seeing it evolve, and I think a lot of the lessons are coming out of European experiences about taking a more integrated approach. making sure that productivity isn't just focused on how many hours in the day people spend at work. But I think there are some real problems because the small employer, the employer who's dispersed over a very wide terrain, whether it's a trucking company or a blue-collar worker demanded job, people on the coalface and extractive industries, the oil industry, this is a little bit far off for them to achieve over the next few years.
I mean, this is a country where a significant number of people don't have sick leave.
Yeah.
So.
Yeah. I'd say the open bar would be popular at our place. But I am reminded on this point that, and I think it goes to what you've said, a colleague of mine got all this data from France and nutrition data and data around alcohol use and job and things like that. And she ground on it. And the one thing, but the French have, relatively good parameters in terms of overall public health. And the one thing that's sort of highly correlated with low morbidity was had lunch at home. And I think, it speaks to sort of sense of community and orientation towards work that I think it'll be difficult to repeat in the United States. I was thinking about this crowd today. I had the delightful hour this morning. I went to the gym. Nobody else was there. And I was trying to decide, is that because, is that a good thing or a bad thing? I figured maybe it's a good thing because everybody feels so, sort of healthy and health-oriented, they're all sleeping in, so.
I had an 8 o'clock session.
I think one of the things we're seeing happen in the Google and other space around something very pragmatic is around food at work. A large number of employers, as I say, in many places, people are not thinking about the quality of food, either in the canteen, if it's a large canteen, or in the vending machine. They're also not looking at the fact that many of the larger employers have actually got kitchens, which could be used to teach people some basic cooking skills, which, as you know, have been forgotten in many populations. And there's now a movement around food at work. Google's playing a big role in it, which I can see starting to cross the country. The impact of that is very interesting because when you start doing that, you're first showing the workforce that you value them and food is important. You're then able to also introduce ideas about what is healthier food and what is less healthy food. And through a whole lot of behavioral economic designs, you can make sure the healthiest option is always the easiest option for people to have. But then you can start addressing issues around portion size and many things. And people take these messages home. And the hope is that they will actually start mirroring and doing these things with their families and communities. So I think the Food at Work initiative is going to be the equivalent of what we've seen on looking at the hours spent at work as one of the next big movements. By the way, it also has very interesting environmental and agricultural impacts because they suddenly look at who's purchasing and where you're purchasing from. Can you get local suppliers involved, which starts generating some local income as well.
Who else? In the back here.
I'm Natasha Leger with LBX Journal, and you talked a lot about technology and wearables and applications, many of which are now location aware. And so my question is, how do you see location data, applications, and technology as part of the health solution of the future?
Let me give you one example. I can't tell you the source of the information, but I can certainly say what the possible is looking at. Obviously, the caveat is privacy obviously becomes a big issue in these things. And I do think that's why the ethical, legal, and social issues around privacy and data need to be proactively and more actively addressed. I think the Supreme Court decision yesterday is enormously important to study, where you had Supreme Court Justice Roberts saying that a smartphone is an extension of human anatomy. Think about what that's going to mean down the line. So the GPS, we now know where you are and your phone is at every one point. On the most positive side, it means that we also know something usually about people's symptoms. Google a few years ago teamed up with Tefinet, a Canadian group, to see whether they could predict the next avian flu outbreak by looking at the symptom complexes of coming out of SMSs and messages, all de-anonymized, but with location-specific information. And that actually helped preempt the spread of some of the epidemics. Now think of what we can do in this era where you have GPS proximity data. We know that Troy and I had dinner together last night, and our GPS thing says we were together at the same point. But we also know that Troy actually came in with a series of symptoms that looked very close to flu. How do we plan our vaccine schedules far more effectively? How do we use location information to start thinking about more effective ways of not vaccinating the whole population when there's a crisis, but the specific people who may be at risk? More than that, we know that there's great data being done by colleagues at Harvard and elsewhere showing that when people who are overweight and obese tend to have more friends who are overweight and obese, people who smoke tend to have friends who smoke more. Well, these networks link both through real space and real-time relationships, and it suggests effective interventions can be targeted to start having virtuous cycles. When somebody starts on smoking cessation, you can start looking at the networks around them. As I said, many people get very spooked by this and find this really creepy. And in fact, the report we put out on prevention was labeled by some as being creepy big brother creeps writing the report, which we thought was great. I think that the potential positive power of this for good, we haven't even started tapping.
Okay, I think I may have time for one more. There's one down here who I thought I was calling on before.
My name's Tara Sheahan, and I have the good fortune to be married to Casey. And I wanted to ask him this question I've never asked him, and I think it's for all of us, is what's the vision of leaders taking a role in really bringing these practices of mindfulness and conscious leadership to the world, and what does it look like in 10 years? If leaders really understand that be the change you wish to see in the world starts with yourself.
Well, there's a famous quote I heard recently, actually it was over in India, and the quote was, one stone can change the course of a river. So what I took away from that was that everything we do as leaders, whether we are going to embark on a path of changing the healthcare system or to have a more healthy work environment with our companies, that we have to take that first step ourselves. The example of that was I was talking about transparency at Patagonia. It was an initiative called Footprint Chronicles, and it happened after I took a trip to Asia and saw the pretty difficult working conditions that the factory workers had there. And as I reflected on that, I said, before I can go back to my company and try to improve social responsibility, the working conditions, the factory conditions, the eating facilities, the very chairs that some of the women sewers were sitting on, I had to take a look inside of myself and to reflect on how I was showing up in the world. How was I living my life? What kind of impacts was I making? What kind of conflicts did I still have in my life? So the point of this is that there is no transformation of any of the things we're talking about, healthcare, wellness, unless the leaders of these particular initiatives undergo a transformation themselves and then inspire the people who work with them, their customers, their vendors, their on and on, people that buy product from them, because unless the leaders do it, it can't really happen. And so a country, a company that is living in a state of health and wellness, it's a whole system that's interconnected, and it has to start with the leader first. So that's what it means by a single stone can change the course of a river. So, look at yourself, look at how you're living, look at go look at your medicine cabinet today and see what's in there. Do you need all that crap? A lot of it's not that great for you. Is there a better way for you to eat? Is there a better way for you to live? Exercising, drinking better water? How are your relationships with your family members, your children, your parents? Those are all those factors I talked about, because I think the emotional component of this is the most important part to living a life of health and wellness.
One more, all the way in the back.
Thank you. My name is Neeraj Mistry from the Sabin Vaccine Institute. The question I have is, what if the package that you described came at a marginal cost to the bottom line? And I think it might be a reset equilibrium of a triple bottom line, where we're going to have impact on the workforce, we're going to have community impact, we might have to change the types of products we have in stores, etc. But we're going to provide overall well-being and happiness at a marginal cost to the bottom line. And how would companies feel about that?
Well, again, the process I'm talking about takes 10 to 20 minutes a day. I mean, this is a process of self-reflection. If I'm looking at my supply chain and my health of my workers, I have to start here, but look very closely at those people who are around me and begin there. If you try to, eat the elephant, all at once, the only way you're going to successfully do that is bite it one bite at a time. You might have success eating the elephant. So this process is important for all of us, not only in our lives, but in our workplaces, and looking at the products we make. At the end of the day, it's more important that we have a happy workplace, we have happy people, because last I saw, business was about people buying from other people. And so if that workplace and that group of people aren't happy, it makes business very difficult. And we've seen examples when organizations, companies, corporations, even our government are operating in a very conflictual way, which means that there's a lot of ego, there's a lot of ambition, there's a lot of drive, and some bad behavior, as opposed to companies that are operating from a place of higher purpose, their mission, they're bringing things that bring meaning to life, and they inspire all their employees to be a part of that. It's a different kind of workplace. Those are kind of workplaces that are more creative, they're more passionate, and they get stuff done that elevates mankind. And that's ultimately the goal of this whole conference, in my opinion, is how do we get to a place where we're making lives better around the world.
And CVS has already basically made that decision, right, to forego the revenue from tobacco by taking it out of the stores.
Short-term loss. I think, I would say that, if you're creative, you'll be accretive to the bottom line. There's enough poor health out there and enough challenges that there should be things people can do that are eventually going to sort of return value to shareholders. So I think, sort of taking $2 billion out now, long-term, that's going to be a very smart decision.
Okay. Do have time for one more. Who's got it? Anybody? All right, anybody have any closing thoughts here?
Well, maybe just to say that I think that the notions of creating shared value, which Michael Porter and others have spoken about, moving beyond doing things for philanthropic reasons to building into the bottom line the kind of social and health improvements that we've heard, I think are going to become increasingly the norm. And we're seeing it being driven both by particularly millennial consumers demanding that is what they consider a good company. They don't want to work for them. They don't want to buy their products if that isn't the way they work. And we're seeing the investor community, particularly the inspired investor community, whether it's big investors from BlackRock and Deutsche Bank and UBS and CalPERS, looking very seriously now beyond the financial statement into the sustainability measures, the environmental measures, not because they're nice things, but because they're also material to the long-term sustainability of the enterprise.
On that note, well, thank you. Thank our panel.